and the global opportunities. My name is Dr. Albert. I'm the Chief Medical Officer at Heidi Asia. I'm a practicing clinician still as a GP allergist. And what I wanted to start off with is talk about the Australian AI healthcare landscape. Melbourne is home to about 188 AI companies in healthcare, 22% of which is clustered in the city, making it the largest single sector cluster in Australia. As you can see, all these companies originated from Melbourne. Well, I often ask the people who are starting up in this area, what is the problem we're trying to solve using AI? So a lot of people then look at, and I would like to ask the audience, what do you think? How do you think we should approach using AI to solve AI healthcare problems? What are some of the areas that we should be thinking about? And in the end, we are all grasping at the different parts of the elephant. And what you will see with these other companies who I talk about, they talk about something like what Daisy talks about, recruiting problems. They talk about specific workflow problems like having continuity care or diagnosed with ENT problems and so forth. But they're all grasping at one segment of the elephant. So I then asked them, challenge them to think about, are we trying to solve a faster horse problem where we actually get to the next stage of the delivery of care and hurry up and wait, so to speak? The other thing that you could try to solve the problem is think through how we're spending the money to solve the healthcare problem right now. This graphic comes from how the American system is using their healthcare expenditure in hospital systems in America. And as you can see, 56% of it is in a labor force, and then drugs is 9%, supplies and other type of other things account for 22%. So is this a good way to try to solve the problem? Well, at Heidi, we try to think of some different approach to the problem. Because if we want to transform how we deliver healthcare, we've got to start and say, what are the key areas that we want to solve? One of the areas we think about is the workforce situation. McKinsey put out a report in May of this year, which talks and estimates about the global healthcare worker shortage reaching up to in excess of 10 million by 2030. If we tweaked all the traditional supply chain issues, incentivize and get more healthcare people to enter the workforce, we could probably add another 5.6 million to the workforce. But closing the shortage of service delivery can avert about 180 million years life lost to early death and disability. And this could boost the economy by $1.1 trillion. So it is incumbent upon us working in this area to think about how we can transform the healthcare delivery through AI services. The other box that we think about is the medical knowledge doubling time. In the 1950s, it took about 50 years for the medical knowledge to double. By 2020, it's dropped down to 73 days. That means that those who entered medicine in 2010 will only master about 6% of their medical knowledge by the time they were 10 years into their career at 2020. And another bottleneck that we identified was that clinicians tend to struggle to apply relevant research, new technologies, and then hence improve their patient care because they had to process everything into that single point and then get to deliver the service to the patients. So at Heidi, we think about how to give back to clinicians time in the first instance and become an AI partner in care. So we divided into 3 areas of tasks that we wanted to approach, starting from low risk to high and moving to high risk. So the first tier that we looked at was the information collection and administration of that data and information. Very low risk, it's all existing type of stuff, but using AI to enhance that information so that we can utilize it in a healthcare service delivery was what we thought would be a good area to talk about. Using AI to develop decision support, processing all that medical knowledge doubling time into information that you can consume as a clinician. That's the next area that we're working on. And ultimately, gathering all the medical information that's on the market to then help with the actual service delivery of management and treatment. That's where we want to go to in the future. So this US survey in 2024 by the American Medical Association showed that the average clinician spends about 27.2 hours a week delivering direct patient care. Indirect patient care, including documentation, order entry, referrals written to other departments or service providers, constituted about 13 hours a week. Administrative tasks, including form filling for insurance claims, pre-authorization, meetings and notes, and so forth, another 7.3 hours. And after hours work, which each individual clinician has to do to try to reconcile all that information, took about 1.5 hours on average. And that constituted about 20 to 30 hours plus of work per week in administrative and documentation time. And this was also reflected in recent reports in Australia, and the complaint about that administrative burden resulted in a reported rate of 85% of our clinicians experiencing burnout. At last count, 71% of GPs reported burnout in the last 12 months. And those who are in training right now report that 39% of them have felt that the hospital was not supporting their mental health care and well-being because of this administrative and documentation burden. So only 2 years ago, Heidi unveiled the first product that low-risk tier of documentation organization. The product was an AI ambient scribe. What it did was, if you turn on the scribe in the background, it listens to you have a medical encounter with the patient. It then customizes your notes to something that you can reuse, and then you can create documents forward to actually forward the patient care from there. And what that is, it sounds very intuitive and simple. It sounds like something that you could use any Copilot or ChatGPT or anything to capture. But because we only filter in the medical information and filter out everything else, the reconciliation time the clinicians use to actually correct medical notes is actually a big plus that we found. A lot of the handwriting notes were gone, and we had more clear and legible records. We had undivided attention by the clinicians with the patient because they were actually looking at the patient. You had better eye contact, you had better interactions, you could pick up non-verbal cues of patients and so forth. And the information was optimized for handling because you had clear notes and they were accurate and complete, and it was reutilizable and extractable into different forums and so forth. So if you talk about 5 different things in a medical consult, you can reutilize one portion to the relevant onward provider that you need to refer to, say a physio or another specialist and so forth. And it allows for more rapid delivery of care for the next step of care. Personally, as a clinician, I found an unintended byproduct was that I articulated out the physical examinations to assist with the AI and the transcript, and it increased the patient's literacy and interest in their own sort of physical examination. For instance, when I examined someone with a shoulder injury, I told them they could flex it 30 degrees, and the next time they came in, they asked me, "Doc, how many degrees can I flex this time?" And so they're more engaged in their rehabilitation and improvement of their healthcare. Another byproduct, unintended, was that I was getting home on time. And my wife said, "Get away, I still haven't finished cooking." So I ended up playing more sports, and I became healthier as a result of that. So this article came out from the JAMA Network Open in August of this year. And it actually is a formalization of many similar reports around the world about ambient documentation technology decreasing the physician burnout and burden of documentation. So, and you can find, if you just use ChatGPT or whatever to search this information, you find hundreds of these type of papers out there already. So in 2 years, from 2023 to now, we have become the most used AI scribe in the world. When I first started, we had about 50,000 transcriptions per month, and now we're up to 10 million transcriptions per month. We're #1 AI scribe in Canada. 1 in 3 GPs use it in the UK. In the US, we are transcribing over 2 million sessions per month. Australia is 1 in 4 GPs that use Heidi, and New Zealand, 1 of 2 New Zealand government-backed scribes is Heidi. And we're also backed by world-class investors as well, not only Australian, but US investors, as you can see there. Last month, we estimated we gave back clinicians about 18 million more hours for patient care. Imagine that, that's virtually doubling the workforce. 11 hours saved per week per provider, $110,000 cost saved annually per provider, 88% more reports being more comprehensive and legible. 93% of the providers reported stress reduction, and 95% of providers feel that they were more present in the consult, all which translate into better patient care. So we are now moving into the next phase of what we just did in the first tier. And last month, we raised another 65 million USD to fund the second tier of tasks that I demonstrated, and we're going global as well. And thanks to people like Invest Hong Kong, we are moving towards the Asia hub, especially looking at Hong Kong as our hub. Last month, actually 2 weeks ago, we actually had a launch event in Hong Kong and Singapore, and it was well attended by all interested parties, from governments, like Invest Hong Kong, ITIB, Oasis, and so forth, to the hospital authority in Hong Kong, clinicians of all grades, and investor groups as well. Okay, so I'm going to move forward and talk about what the global opportunities from Melbourne AI technology companies, especially in healthcare. What is everyone spending on in terms of AI healthcare development globally? Well, I would focus you on the 2 main markets, which is the US and China. From 2013 to 2024, in terms of USD, America outstrips China's spend in terms of AI investment to the tune of 471 billion versus 119 billion. But what is, and that's close to about 10 to 11 times multiple of China. And just as an incidental thing, Australia is spending 4 billion. But what that translates to in terms of market revenue is that China is generating about $1.6 billion, and US is about $11.8 billion at the moment. The key line is the second line here, because the CAGR is at 42.5% and versus 36.1%, and the clinician design for AI in China is much higher at 53%. The regulatory pace that you talk about is much more focused on commercial development and faster in the Asia-China market, and much slower in more westernized markets, which focuses more on rigor, safety, efficacy. In October of 2024, China unveils its first totally AI hospital, meaning there's virtually no staff in that. And over that 9 months, they've now actually moved from 3 conditions that they can move, they can manage confidently, to 42. So that actually translates into a lot more service being delivered in the areas where there is no healthcare worker that they could deliver the service in China. And this is going to continue to expand at an exponential rate in terms of this hospital. And there's plans for them to actually move this into other provinces and hospitals as well. Incidentally, as a clinician, we did a field test to test the accuracy of the diagnosis. And in the same region, the AI hospital could diagnose at an accuracy rate of 71% versus 79% in the doctors in the similar region. So not much in terms of actual difference. And in where you have healthcare worker shortage, something is better than none. So I think if we are going to think about the future of the global opportunities, especially for Melbourne people, we should think about moving from assistive to agentic partnerships in healthcare. So whatever you're thinking and dreaming of developing from here to go conquer the world, think about not just being in the assistive range that we did in the first 2 phases of what we're doing. We're going to move into agentic data management, decision support, and treatment and management of patients and so forth. Live data can now be sort of collated and organized into personalized care and deliver better outcomes to individual patients. There's a huge biotech hub, not only here in Australia, but in China and Hong Kong. There's this great opportunity from the Shenzhen and the Greater Bay Area partnerships to springboard into the Greater China through that zone development of R&D, pharmacology, and biotechnology. InvestHK suggests that you should think about the core technology themes in healthcare through the left column here of interactive systems, multimodal technologies, simulations, evaluation infrastructure and sensors in terms of devices and so forth, and especially foundation models, going from low to high stakes according to that vertical stack as you translate across to the rest of the table. So here we are. I've reached the end of my talk, but I'd just like to show you some pictures of last 2 weeks ago where Heidi went to Hong Kong and Singapore, and we got into some press about starting up a base in Hong Kong next year. We've also started setting up some university partnerships with Hong Kong University and HKUST, which is just last week has announced that it's going to be the 3rd medical school in Hong Kong. And so we are doing some collaboration of AI research with HKUST as well. Thank you very much.